I think that first and foremost, there are a lot of misconceptions about clinical trials. And I've had some patients initially say, when I say the words clinical trial, they immediately think guinea pig. I don't want to be experimented on. So one of the first things I always say is, here's some misconceptions that I want to clear up. Number one, a guinea pig trial, as you may understand it, presumes that you are healthy with no disease, and I'm going to give you something experimental that you actually don't need. So that's not the case. And number two is that there's no potential benefit to them. It's all for the doctors and for science and things like that. Up until 2005, when there was no standard of care treatment for a newly diagnosed glioblastoma, the NCI actually specified that clinical trials was better than standard treatment because there was no clinical trial. What we see in our experience with clinical trials is that even if a clinical trial medication ultimately does not work for the majority of the population, we know that they're individual patients that, for reasons we can't fully figure out, benefit. So number one, you could potentially benefit from something that may not necessarily work for somebody else with your diagnosis. Number two, you would have access to a treatment that you would otherwise not normally have access to, that a doctor can't just write a prescription for. Number three, people are generally followed much more closely than they would be out in the community because of the clinical trial protocols. So we follow not only how you're doing, but how you're feeling, side effects of treatments, neurologic complications, and things like that. So they get a lot of close follow-up. And ultimately, the other thing also is that when they're using a clinical trial as an option, we do reserve the standard treatments as more options for them. So rather than use up the standard treatments first, if they can enroll in a trial and we can reserve some of the standard treatments for later, that gives them more options later on. So I see a lot of benefits potentially for patients to enroll in clinical trials. One thing I would like to say is that for other diseases for which there are established first line, second line, third line effective drugs already approved, maybe clinical trials are not as urgent for them because there are effective trials. There are very few effective trials for brain tumor patients. In fact, for recurrent brain tumor, there is no approved medication that has been shown to actually make people live longer. None. The only way we are going to make any headway into finding effective treatments is for patients to enroll in clinical trials and see what treatments are worth developing and what treatments probably are not going to work, and we need to redirect our resources.